We do, as part of this evaluation of the CCTV network, it does meet most of the Institute of Criminology's recommendations of external evaluations into CCTV. We're sort of ignoring, well, we're not sort of, we are ignoring the technological capability because that's way beyond our level of knowledge. But in terms of the processes and the ability it has to reduce or curtail any alcohol-related assaults and other issues as well, which is interesting. I mean, you know, this is a system that's been operating in Cairns. The first camera was installed in 1995, so it's been going for, what's that, 17 years now, and a lot of money's been invested into it in the infrastructure. A lot of money's invested into it in staff, and how do we maximise return on investment to the ratepayers, basically, for that. So yep, we're using a continuous quality improvement training and evaluation methodology. Part of that will also, it's planned to include a cost effectiveness analysis later on, probably next year. There's a whole lot of other range of issues that we're using, and I don't really, and I'm not going to get into some of the philosophical and moral implications of closed circuit TV. The fact is they're here to stay. You know, so much money's been invested by governments. The proliferation of CCTV systems around the world, you know, it's probably come close to reaching saturation point now, but between, say, the late 90s and a couple of years ago, the uptake was just accelerating across all local government areas, particularly in the UK and in Australia and in other jurisdictions as well. There's heaps of published research on that. And there hasn't really been a debate. You know, Dean Wilson's called for a debate moving beyond the simple Big Brother thing. Is it good or bad? And there's been very little research by people who are the subjects of monitoring, I guess. An interesting one from Canada a couple of years ago was focused on homeless people, and you know, there was a significant proportion of respondents of these homeless people who said they used the cameras to keep themselves safe. They'd go and do stuff where they knew the camera was there so that they could be responded to if there was a medical emergency or some sort of crime would happen. But there's a whole lot of further research that has to be done on that. Yeah, it's politically very, you know, politicians love it as well. So they're here to stay. I think that's the approach. That's the approach we're taking anyway. So how do we start raising some of these issues around privacy concerns, and also, you know, tangentially, what is privacy in this age of Facebook, mobile phone cameras? You know, what are the people's perceptions of privacy, people who are 20 and under compared to people like me who are 240 and over? You know, what does privacy mean to us? And one interesting one, this is not actually the best example of it. I've seen it do much more powerful things than this. But we presented this to a group of 150 Year 12 students and the lead up to schoolies and end of year celebrations. So this sign here is that bicycle there. And that's, you know, that's one of the older cameras. So yeah, these two slides were part of the Think the Drink initiative, which was delivered to 150 Year 12 students. And that was an initiative of the Cairns City Licensees Safety Association as well. Paul Garnham was the then president. They partnered with Cairns Regional Council, the Youth Substance Misuse Service, Sexual Assault Service, the Police Service, the Queensland Health, Alcohol, Tobacco and Other Drug Service, and our team to do a suite of presentations to people who are about to go out and celebrate ending school. There was an extremely low awareness of the CCTV stuff. There was sort of a vague recognition, yeah, it's there, but, you know, but showing them the power and the scope and that there's 81 cameras in this area and that anything that happens will be picked up brought about a totally different reaction. So that's another area. Unfortunately, we were invited to do that presentation, but it was outside the scope of our project and we didn't have the resource at the time to do a proper evaluation of it. But that, you know, just the feedback from the students was that, you know, it just had them sitting back and shaking their heads and sort of, you could see them rethinking things. Just like to focus briefly on the complexities of the emergency department stuff. As you know, as we all know, their job is to save lives, and that was reflected in the comment of one of the young doctors. It was about 2 o'clock Saturday morning, and you know, he'd just been stitching someone up And he said, I don't believe in research. And it's totally understandable why. But luckily we do have champions in there, like the Director of the Emergency Department, Rob Bonnen, the Director of Nursing, Dennis Bryn, Hayley Cooper, who's the Nurse Unit Educator, and our co-investigator, Richard Stone, who's a staff specialist. So he's a co-investigator on the current intervention level study. And some of the good reasons to get involved, it is clear because, you know, it's a triage, trauma-focused emergency response workplace. The culture there is really focused on that. It's like, fix these people so they don't die. There is potential, we believe, to have that two-way feedback of information from what the emergency department sees and finds, feeding that back into community safety, community crime prevention level initiatives that can ultimately reduce their workload. So breaking that isolation is something we're looking at trying to do, and we do again have a number of champions in the ED to do that as well, which would reduce things that are, you know, of pressing concern to them, like violence against staff, the repeat presentations, and there's real potential as well for the whole victim support interventions at the emergency department level. So this is, as a result of the feasibility study and the pilot study, there are some real potential gains, and there are a number of projects that have sort of grown out of it as well. The one back to the interventions, there was 80% of people, I think, talked about getting people out of the late night entertainment precinct quickly after they'd finished drinking and finished having a party. There was a horrific sexual assault on a German backpacker that happened, I think it was September, October in Cairns as well, and that was just after we'd presented the findings to one of the focus groups, that particular focus group is called the CBD Safety Summit, and it's chaired by Joanne Lillywhite from McDonald's Lawyers. That involves venue owners, council, taxi, Sunbus, police, and I think that's about it. But it's and the business as represented through the lawyers, so it's business, industry, and ancillary industry sort of stuff. And just after we presented that, the president of the Licensees Association again saw about getting people out of town, and he used that information to go back to the, and then it was horrible, and the timing was interesting though, in that we presented that and 2 days later there was a sexual assault which was really bad, and he used the information from our study to go to the local Member of Parliament and ask for some funding to get a late night bus that specifically caters to backpackers at the venues, taking them home so they don't have to walk through those northern egress routes. So there have been a couple of concrete things come out of the study as well, and that is still, backpackers accommodation venues and Licensees Association, they're still negotiating as to where the money's going to come from and the best way to do it. Now, so back to the victim support role, and I'm with the AIC conference coming up in May as well, which should be fantastic. Queensland has recently, the Department of Justice and Attorney General has recently funded a range of victim support services, including client support. Thanks, lucky. I thought there'd be plenty of time for questions, but there may not be. But prior to that, the Police Service approached Relationships Australia, who have the victim support contract, therapeutic contract in Queensland, and suggested a multi-agency group focusing on supporting victims of crime in it. That's also led to, previously their focus has been on getting volunteers in policing, which are basically people who go into the police service. They get access to a limited amount of police information and get tasked by officers in charge of stations to go around and visit people who've had their homes broken into with some home assist and home secure sort of information, and do that personal follow-up with them, and also refer them to some therapeutic agencies who can help them if they choose to take it up, and also marketing the fact that there are all these agencies out there. There's brochures and a website. These are the members of the Cairns Victims of Crime Support Committee, and as you can see, it's a wide range. The Cairns service system supporting victims of crime is extensive, very committed, very dedicated, and extremely underfunded. And there's formal agreements and memorandums of understanding between a lot of these network partners. This is the back page. This was just to illustrate the partnership that's taken. On the front page is basically a referral flowchart diagram. So that's going out to all the different agencies and also, frontline coalface service providers. So this sort of partnership happens in a place of real need. Cairns has only got 2 out of 16 suburbs which are above the CEFA index for the lowest above the CEFA index for disadvantaged. The average disadvantage, there's only 2 that aren't classified as disadvantaged suburbs in Cairns. Additional to that is that we're the service centre for Cape York and Torres Strait Islander communities. And the region itself, there's also the Tablelands Regional Council and the Cassowary Coast Regional Council, both of whom are well along the track for community safety and safe communities endorsement through World Health Organisation. The Tablelands Regional Council is going the World Health Organisation affiliated partner route, and the Cassowary Coast Regional Council is doing a different version of that, but they're both well down the track on community safety and coordinated partnered crime prevention and injury prevention strategies, and lots of actions coming out of them as well. Cairns itself is an internationally accredited safe community. That happened in 2009. Key findings. This sort of stuff is happening in an area of real need. That's the point I was trying to make with that one. But key findings of the study, we've established that it's feasible to do sustained data collection that takes virtually no time for the agencies to collect and to feed through. Sharing of data is possible, and sharing of data through to stakeholders directly with a mandate to do this sort of thing has had tangible results. One interesting finding we found is that prevention of alcohol-related assaults is sort of everyone's core business, but it's no one's core business, and which echoes similar sustainability issues in previous studies. Ross Hommel did one in Cairns, Townsville and Mackay back in the mid-90s, and this is a sort of pattern. While the intervention is going on, there's a reduction in alcohol-related violence. Once the intervention stops, it returns back up to previous levels, 6 to 12 months. So that's us. We're an independent information broker, really, that people trust. And so once that happens, if this research finishes or when it finishes, will it return to previous levels? Evaluations and information are requested by stakeholders to improve their operations. And the closed circuit TV system in Cairns limited assault in 40% of incidents, and there's potential to prevent assault in 26% of incidents in the CBD itself. Recommendations are pretty self-explanatory. They cover a lot of stuff that I've talked about. Charmaine has Yonkers work with security providers as a potential way to reduce assault. Further research into the capacity of the CCTV to interrupt assault sequences. Further research into emergency department staff safety, data collection and public health collaboration. I'm just reading this in case you haven't. And an economic analysis of how much these sort of assaults cost each agency, and also how much is being spent on different agencies or as part of the collaborative network to reduce this sort of impact on the local economy. So it's a very small, we're lucky we've got a small geographically consistent area that we can look at, and there's a number of methods we can use to look at that. But that will, looking at trying to engage an ecological study design approach for that, for all of these things, I think. And acknowledgements. Without these people, nothing would have happened. Thanks. Any questions?